This is LiveWell Talk on Influenza. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health St. Luke's Hospital. It's flu season, and flu shots are highly recommended. Each year, we try to guess our best how serious the flu season will be. And with me today to answer some of those questions and provide guidance for prevention and vaccination is Dr. Ahmed, infectious disease specialist, joined by his trusty sidekick, nurse practitioner, Kristin Baker. Welcome.
Thank you for having us.
Well, it is flu season, and I know we spoke about this yesterday at a meeting about the influenza vaccination and whether or not it's going to be accurate or effective, I should say, this year. But what do you recommend as far as the flu shot of when they should get it based upon timing in the year? Is it ever too soon? Is it ever too late? What's your experience?
Well, let's just talk about the influenza in general first. I mean, influenza is acute respiratory illness that comes in epidemics, usually during the winter season. So usually, if you want to get the flu vaccine to prevent that infection, usually we'd like to start in October. It's between October to May. So basically, if you want to start in September, that should be okay. And usually it is never too late. This is what I'm going to say. If you're even still in November and you didn't get the flu vaccine, you still get it. So never say that, oh, it's been March, we're done. No, I would not recommend that.
Now, is there a delay until the vaccination works? And how long is that delay?
Yeah. So usually this is the way how we come up with the flu vaccine. We have global surveys all over the world. We just look at the circulating viruses at the end of the flu season from the previous year. And then we come up with what are the most common strains of the virus circulating in the community. And according to that, we decide which vaccine or which strain should be in the vaccine. And that takes around 6 months to develop the vaccine.
Now, we'll get into the vaccines here in a minute, but there's other ways to prevent the transmission of flu. Kristin, what are some of those other ways that someone can do on their own to survive the flu season?
Like you said, the single best way is to prevent the seasonal flu is to get the vaccination. But other measures that you can do is covering your mouth and your nose with sneezing and coughing, making sure that you are washing your hands, good hand hygiene with soap and water. The second best option is using antibacterial hand cleanser. But I always tell patients that using soap and water is the best of the options if that's available. Other ways to prevent it is making sure that you're not touching your hands to your face and your eyes. Those are some good measures to adhere by to prevent the flu.
And if I have the flu, how long am I contagious?
5 days.
5 days? Okay, that's good advice for avoidance on that standpoint. Dr. Bullfull, over the years, there's been controversy with the vaccines. We remember the autism association that's been completely disproven. And actually that physician, I believe, was sanctioned, if not lost his license in England. But tell us about what are the vaccines out there and what do I need to know about the vaccines if I'm a patient?
Well, I'll make it simple. Usually we have two main categories of the vaccine. We have the live vaccine and we have the non-live vaccine. Live vaccine is indicated for certain age group and usually people between the age of 2 and 49, as long as they're not immune compromised and not pregnant individuals. Then we have the not live vaccine. And we have quadrivalent vaccine, we have a trivalent vaccine. Trivalent meaning that they have 3 strains of the influenza virus, 2A, 1B. The quadrivalent vaccine, it has 4 strains of the influenza vaccine, 2 strains of A influenza virus, and the other one is 2 of the influenza B virus. Now, if you just, some of them are the development of the vaccine, sometimes it has something to do with the impregnated eggs. And, sometimes we use different technology to come up with the vaccine. So, based on your age, health status, medical illnesses, we decide which is the best vaccine to go with. We have high-dose influenza vaccine where we use a higher concentration of the virus in the vaccine, and usually this is indicated in people above the age of 65. The reason for that, or the rationale behind the higher dose, is higher immunity, because those people above the age of 65, they're at higher risk of complication after influenza infection.
Now, is the higher dose also quadrivalent, or is it?
It's a quadrivalent.
Quadrivalent.
Yeah.
And what do we give here in the hospital? I think we give the quadrivalent for the inpatients as well as the employees.
I think so.
Yeah.
We have,
Well, in the past, there was this relationship with, I believe, the swine flu and Guillain-Barré, or Guillain-Barré, but it's actually pronounced Guillain-Barré. Tell us about that. Is that a risk? Should I be worried about getting Guillain-Barré if I get the flu shot?
I think there was something about this around the swine flu, and there was a lot of studies, and even like there was a meta-analysis study that was, I remember I was a fellow at that time when we looked at that, and then we found actually that the Guillain-Barré, it comes, whether it is the flu season or not the flu season.
Correct.
So basically, if you look at the prevalence and the incidence of the Guillain-Barré on those years, and the time when we gave the swine, that the influenza vaccine at that time, we found that the same thing. There's no difference. So I don't think that, the influenza vaccine is associated with, will put you at a higher risk for the Guillain-Barré. At the same time, I think you talked about the autism. And even I think right now we have a lot of meta-analysis, we have a lot of studies looking at kids and the risk with autism and the other vaccines too, and we didn't find any evidence of that. Even I think we have recent studies looking at kids with siblings with autism, which meaning that we understand there could be a genetic component for autism. So basically we're talking about at siblings with autistic, like siblings, which means they are at higher risk for autism. Even with the vaccines, we didn't find any relationship between the autism and the vaccinations.
That's good to know. I mean, I think one of the greatest accomplishments, other than perhaps going to the moon, is the immunizations and vaccinations. We've eradicated polio, smallpox, measles.
Yeah.
Well, we can talk at a future podcast about how that's coming back. If you didn't have Walter Reed and the yellow fever vaccine, you wouldn't have the Panama Canal or the Suez Canal. Those vaccinations helped that get done. Well, that's really good information. Thanks for joining me today. Thanks for clearing some of that up. As I said earlier, I think vaccinations are just amazing what they've done to eliminate death and disease in the world, and really shouldn't underestimate the power of that vaccination and getting a flu shot. That is Dr. Ahmed Abulful, infectious disease specialist, and Kristin Baker, infectious disease nurse practitioner. And great information, and thanks for coming today.
Thank you.
If you have a topic you'd like to suggest for our Live Well Talk On podcast, shoot us an email at stlukescr@unitypoint.org. And we encourage you to tell your family, friends, neighbors about our podcast. Until next time, be well.